Hi, my name's Anna. I'm a nurse on 3 West, and today I'm going to be discussing what to expect following your surgery, what are our patient care boards in your room, what to understand with the post-operative nursing priorities that we will be doing with you, and I'm going to introduce you to the healthcare team. So when you immediately come out of the operating room, you will be in the recovery room called PACU. That time you will spend in PACU may vary from 30 minutes to an hour and a half. Once you are ready, you will be transferred to the post-op unit, which is 3 West, which is with us. When you first come to the unit, we will give you welcome information. We'll do frequent vital signs on you. We take them very frequently within the first few hours after surgery and closely monitor you during the recovery time, so you won't get much sleep time. Pain management. Your pain management regimen is determined by your doctor. You may have several different medications ordered to manage your pain. These medications may be scheduled and PRN, which means as needed, so you have to request them. The nurses, so me and your doctor, will work with you to find what medication works best for your pain. Surgery is painful, and it is normal to experience pain. We also incorporate non-pharmacological methods to help reduce pain, such as ice, elevation, and rest. The goal is to treat your pain so that it is at a manageable level to enable you to participate with PT and mobilize. An example of a medication that you may be on, depending on who your surgeon is a PCA pump. You are connected to this through your IV, which is in your extremity. And anytime you have pain, if you can't breathe through it with a non-pharmacological method, you push this button and you are delivered narcotics. We try to wean you off of this as quickly as possible because it inhibits you from going home. We got to get you on the oral pain meds instead. Next, we do assessments of every extremity and body systems. We will frequently do this 2 times a shift on day shift, 2 times a shift on night shift. We do brain to lungs to heart to bowels to urinary, and then of course your affected limb we will assess very frequently as well. We ask questions about how things are feeling and moving. We check in with your mentation, circulation, and movement. So whenever something feels off, we want to know, and then we will relay that to your doctor. IV fluids will be initiated when you're on the floor just to help with hydration. The length of time you're connected to IV fluids is determined by your doctor, and of course how much you're taking in orally. Let's see here. Oxygen. Sometimes you'll come up on oxygen, which is totally normal. Sometimes you just need the little boost after anesthesia. So nothing to be alarmed about on that regard. Assisting with ADLs, which is activities of daily living. So we will help you with toileting, with bathing, everything you need. Patient care boards. So they are boards in your room that have sections so we can write notes on for you, for us, for the doctors. It has references like how many times we've checked on you, even if you're sleeping. Pain level references, and contact information. Even though it's in the chart, it's sometimes helpful to have it on the board too. And we can write, like I said, anything we want on it. Post-operative nursing care priorities. So blood clot prevention. That is super important after surgery, especially joint surgery. They can increase your risk for blood clots. Often some sort of blood thinner is ordered by your doctor, which is either a oral medication or an injection. Other ways to prevent blood clots is moving, so ambulating, wearing compression stockings, and or wearing, they're called SCDs, which are leg squeezers to massage your legs. And the purpose of these is to help direct the flow from your lower extremities up to your core to prevent swelling and edema. Pain control medication is often ordered scheduled, so it comes automatically, and or PRN as needed, which you request for. Fall prevention is huge in the hospital, so we will ask you to call us before you get out of bed just to have someone in the room in case you lose balance or get dizzy, which is very normal as well. Deep breathing. So you use physical therapy for your new joint. A incentive spirometer is physical therapy for your lungs. So with this machine, you actually inhale, deep inhale, and it helps prevent pneumonia. It helps re-expand your lungs, so it's super important after surgery. So you'll be doing that hourly while awake. And like I said, resuming daily activities such as toileting, dressing, which may be hard sometimes after new joints, bathing, and toileting. Your healthcare team, we are color coordinated. So nurses are in this maroon color, as you see. Nursing assistants are in gray. The operating room staff, which you may or may not remember, is in light blue. Rehab is in also another color, light blue. Respiratory is in green. Lab is like an olive. Environmental services, our cleaning staff is in a navy blue, and radiology is in black.